So today we're going to talk about drugs affecting the female reproductive system. So female reproductive system functions in a cyclical fashion, and most of the drugs that affect the reproductive system are hormone and hormone-like agents. So sex hormones and estrogen receptor modulators. So sex hormones can be used to replace hormones that are missing, and it acts on to control the endocrine system to decrease the release of endogenous hormones or hormones that develop inside the body. And drugs that act like estrogen are used to stimulate the effects of estrogen without or with fewer adverse effects. And those sex hormones includes estrogen and progesterone. These are the examples of estrogen, and these are the progestins. So, therapeutic actions and indication of estrogen. Estrogen is used for hormone replacement therapy, HRT, when the ovarian ovarian activity is blocked or absent. And it's used to relieve the discomfort of menopause, like irregular menstruation and vaginal dryness, and also vaginal yung low fertility, and also to treat female hypogonadism, which is when the sex glands produce little or no sex hormones, and also ovarian failure, and to prevent postpartum breast engorgement. And it is also part of the combination contraceptives. It's slow bone loss and osteoporosis, and relieves certain cancers that have known receptor sensitivity. It's also important for the female reproductive system, for the development of female reproductive system, and the secondary sex characteristics like the enlargement of the breast, the growth of hair, and especially in the underarm and pubic area, and also the widening of the hips. It also affects the release of follicle-stimulating hormone and luteinizing hormone, cause capillary dilatation, fluid retention, and protein anabolism. Then it thins the cervical mucus, conserve calcium and phosphorus, encourages bone formation, inhibits ovulation to prevent pregnancy, and prevent postpartum breast discomfort. Pharmacokinetics of estrogen, it is ingested orally through the GI tract, absorbed, and it undergoes extensive hepatic metabolism, excreted in the urine, and it crosses the placenta and breast milk. Of course, the contraindications and cautions of estrogen, of course, if there are any known allergies, so it is to prevent hypersensitivity reactions, and patients with idiopathic vaginal bleeding or PID. Breast cancer or any estrogen-dependent cancer contraindicated with history of thromboembolic disorder, which is when a embolus or a blood clot travels through the bloodstream and blocks an artery. And it's also contraindicated for heavy smokers because heavy smokers are at high risk of thromboembolic disorders. And also with patients who has hepatic dysfunction, and of course, as I said earlier, since the estrogen crosses the placenta, it's contraindicated with patients who are pregnant. It has high risk for fetal defects, and also with women who are breastfeeding. Patients with metabolic bone disease, so it is any of the several diseases that cause various abnormalities or deformities of bone, like osteoporosis, rickets, and osteomalacia. And patients with renal insufficiency and with hepatic impairment. These are the adverse effects of estrogen. For the GI effects includes nausea, vomiting, abdominal cramps, bloating, colitis. Colitis is the inflammation of the inner lining of the colon. Serious GI effects include acute pancreatitis, cholestatic jaundice, or it is when the essentially normal liver cells or are unable to transport bilirubin, and then hepatic adenoma. GU tract, breakthrough bleeding, menstrual irregularities, dysmenorrhea, menorrhea, or the absence of menstruation, changes in libido or sexual desire. Systemic effects of estrogens include fluid retention, electrolyte disturbances, headache, dizziness, mental changes, weight changes, and edema. If given in these clinically important drug-to-drug interactions, if estrogen is given with drugs that enhance their hepatic metabolism, like barbiturates, rifampin, tetracycline, etc., serum estrogen levels may decrease. Increase therapeutic and toxic effects of corticosteroids or steroids that can be produced by the body or man-made. And also, you should not use estrogen when you are smoking, because it's high risk for thromboembolic effects. And also with grapefruit, because it inhibits the metabolism of estrogen. And also with St. John's wort, same as the grapefruit. Next is progestins. It is used as a contraceptive. It treats primary and secondary amenorrhea. The difference with primary and secondary amenorrhea is when primary is when menstrual period has not has never begun at 16, and secondary amenorrhea is the absence of a menstruation for 3 consecutive months, or it may last to 6 months. And it's also part of the fertility program. It's useful in treating cancers with receptor site sensitivity, transform proliferative endometrium to secretory endometrium. It inhibits the secretion of FSH and LH. Pharmacokinetics, same as estrogen, per orum, and it is absorbed in the GI. Metabolic hepatic metabolism, and it is excreted in the urine. These are available forms as the etonogestrel, it's a vaginal ring, Novaring subdermal implant, the Venorgestrel, combination form oral contraceptive, and Ulipristal, which is a morning after pill. It's a progesterone antagonist. Contraindications and cautions of progestins. The contraindications and cautions are similar to those of estrogen, but PID it's contraindicated with patients with PID or pelvic inflammatory disease, sexually transmitted disease, endometriosis, pelvic surgery, and caution with patients with epilepsy, migraine, headache, asthma, cardiac output. Also, drospirenone is contraindicated or caution because patients are at risk of hyperkalemia and liver disease and adrenal dysfunction. Systemic effects are very similar to adverse effects of estrogen. For dermal patch, local irritation, vaginal gel, headache, nervousness, constipation, breast enlargement, and perineal pain. Intrauterine system, of course, abdominal pain, endometriosis, abortion, PID, and expulsion of the IUD. For vaginal use, local irritation, swelling, drospirenone, anti-mineral corticoid, or it's aldosterone antagonist. It causes the conservation of aldosterone causes the conservation of sodium secretion and of potassium. Next is the clinically important drug-to-drug interactions. So, if it interacts with barbiturates, carbamazepine, and others, penicillin, tetracyclines, it reduces the effects of progestins. St. John's wort can also affect the metabolism of progestins and can make progestin-containing contraceptive less effective. Estrogen receptor modulator, two available estrogen modulators, raloxifene or Evista, terimifene, Thyriston. These are not hormones, but they affect specific estrogen receptors. It either stimulates or blocks the others, and it is to develop to produce some of the positive effects of estrogen replacement while limiting the adverse effects. Raloxifene, so pharmacokinetics, it is absorbed in the GI and metabolized in the liver, excretion, of course, and through the feces. It also crosses the placenta and enter the breast milk. Raloxifene, again, contraindicated just if there are presence of allergy, known allergy, a patient's history with venous thrombosis. It is a blood clot that forms within the vein. Smoking, since it increases the risk of blood clot formation, like I said earlier. And the adverse effects of raloxifene: GI upset, nausea, vomiting, changes in fluid balance, headache, dizziness, visual changes, mental changes, hot flashes, skin rash, edema, vaginal bleeding, and venous thromboembolism. For cholestyramine, reduces the absorption of raloxifene. Protein-bound drugs, same. It interferes with binding sites. Warfarin, it decreases prothrombin. So next is fertility drugs. Fertility drugs stimulate the female reproductive system. Its use, it's used for women without primary or ovarian failure who cannot get pregnant after 1 year of trying. So it stimulates follicles and ovulation, or stimulate the hypothalamus to increase FSH and LH levels to lead ovarian follicular development and maturation of ova. These are therapeutic actions and indications of fertility drugs. Menotropins stimulates spermatogenesis in male. Cetrorelix, it inhibits premature LH surges in women. Chorionic gonadotropin, it stimulates ovulation by acting like GnRH, and then phallotropin, alpha and beta are FSH molecules, and they inject to stimulate follicular development. Pharmacokinetics, it's well absorbed and treated like endogenous hormones, or like the hormones inside our body, and undergoes hepatic metabolism, and it's excreted through the urine. Contraindications and cautions: presence of primary ovarian failure, thyroid and adrenal dysfunction, ovarian cysts, pregnancy, idiopathic uterine bleeding, known allergy, of course, caution for women who breastfeeds, and thromboembolic and respiratory disease. It is other adverse effects. It greatly increases multiple births. Still, birth defects are risky. Ovarian overstimulation too, which is accompanied by abdominal pain, distension, ascites, pleural perfusion, headache, fluid retention, nausea, bloating, uterine bleeding, ovarian enlargement. Gynecomastia is it's the enlargement or swelling of breast tissues in male. That's gynecomastia. Uterine motility drugs. These are drugs that simulate the uterine contractions to assist labor or to induce abortion. Glycolytics, it's used to slow uterine activity. And hydroxyprogesterone caproate, it's reduces the risk of preterm in women. Reduces the risk of preterm in women with single fetus. For oxytocin, under uterine motility drugs, it stimulates the contraction of the uterus, like the action of the hypothalamic hormone oxytocin. It includes ergonovine and this one. Yeah. Therapeutic actions and indications: directly affects the neuroreceptor sites to stimulate contraction of the uterus. This is effective in pregnant women, and stimulates the lacteal glands in the breast, and also for the prevention and treatment of uterine atony after delivery, and prevent postpartum bleeding, of course. But also, the pharmacokinetics of oxytocin, it's oral and it's metabolized in the liver, urine, and excreted in the urine, feces, It crosses the placenta and breast milk and can be administered intramuscularly or intravenously. It stimulates milk letdown, or when the breast pushes out the milk. Next is contraindications and cautions of oxytocin. Of course, if there are any known allergy, first I follow this position. It's when the baby's head is too large to fit through the mother's pelvis. Complete uterine atony, early pregnancy. Caution is with people with coronary heart disease, hypertension, patients with previous cesarean birth, and hepatic and renal impairment. Next is the adverse effects of oxytocin. Uterine hypertonicity, spasms. So hypertonicity are spasms, uterine rupture, postpartum hemorrhage, decreased fetal heart rate, GI upset, nausea, headache, dizziness, cause severe water intoxication with coma, and even maternal death. So you should be careful with giving oxytocin. Ergonovine and methylergonovine can produce ergotism manifested by nausea, BP changes with pulse, dyspnea, chest pain, numbness, coldness in extremities, confusion, excitement, delirium, convulsions, and even coma. Uterine motility drugs under uterine are abortifacients. It's used to evacuate uterine contents via intense uterine contraction. So it's different from oxytocin, who helps in labor. So it stimulates uterine activity, dislodging any thromboplast. It's cells forming the outer layer of the blastocyst, which provides nutrients to the embryo and develop into a large part of the placenta. So it also prevents implantation of any fertilized eggs. Approved use for this is to terminate pregnancy at 12 to 20 weeks from the date of last menstrual period, or LMP. Pharmacokinetics of abortifacients, it's well absorbed when administered, metabolized in liver, excreted urine, used during pregnancy to terminate pregnancy. That's ironic. Mifepristone, it's per RM, 5 to 10 days to produce a desired effect. Carboprost, intramuscular, onset is 15 minutes and duration is 2. Naproxen, that's intravaginal suppository, and its onset is of 10 minutes and duration of 2 hours. Contraindications, of course, if there are any known allergy to abortifacients or prostaglandin, after 20 weeks of LMP, active PID, acute cardiovascular, hepatic, renal, or pulmonary disease, of course during lactation, caused with any history of asthma, hypertension, and adrenal disease, and with acute vaginitis or inflammation of the vagina and scar tissue. Adverse effects are abdominal cramping, heavy uterine bleeding, perforated uterus, uterine rupture, headache, nausea, vomiting, diarrhea, diaphoresis, backache, and rash.